So today we study about this. So I use the paper by Laurette. So much better. Pharmacist licensure exam Module 5 Laurette. So this is the reviewer inspired by. Let's start. Let's go first for manufacturing pharmacy. First, what is manufacturing pharmacy? Manufacturing pharmacy or the manufacturing uh, excuse me. So now let's start with the manufacturing pharmacy study for this one, and afterward we will answer some questions. First, what is manufacturing? Manufacturing the manufacture, propagation, preparation, and processing of a drug product in a large scale. So when we say manufacturing, all about the making of the chemical, everything about the drugs, like doing the procedure that meets the definition of drugs. And also we have here the manipulation, sampling, testing, rolling procedures, apply the final product or other part process. Also in manufacturing, packaging, repacking, the container, wrapper, label of any drug package information for its manufacturer to the farmer. Everything that happened drug from the making, the packaging, everything was the factory. And also we have here for the factory the mass production of the drug product. For this is the production of the drug product. So now let's go to the extemporaneous compounding. So when we say extemporaneous compounding, is a small scale preparation of drug products. So for example, order, no, the prescription order specific for a particular patient. So extemporaneous compounding, ato na siyang ma-apply when we are in the community pharmacy where a physician will prescribe a certain drug for that patient and that is only for that patient. For example, the suspension, as there lot, thing, drug amount. So next is what is drug? What is drugs? Drugs is are drugs. It's for diagnosis first, prevent, for mitigating a disease for human and for animals. So we have a lot of kind of drugs nowadays, and also drugs. This recognized by the USP or the um US United States Pharmacopoeia or the Shell Compendia. Yes. And also drugs that applied to affect the structure and its function. And also it is components. uh, So next, that's the drug. Now let's go to the drug products. Drug products are the finished form with or without with or without active ingredients. So there are a lot of kind of products. Later on, we will products. So we also have this placebo, which is placebo is example of an inert gas that has no or like has no active ingredient. So next is the dosage form. So dosage form can be a drug and additive. Means that this is a pharmaceutical form of the preparation based on the official pharmacopoeia. So we have batch here, batch, lot, batch number or lot number. This is very important in making a product. Where batch this is produced from a single order within a single cycle of manufacture. The batch number and the lot number we can it in packaging of the product. And also the batch is a quantity of any drug or device produced during the given cycle of of manufacturing. Next is the lot. This is the version of batch. So batch is for identification. We have a different batch number and lot number. So batch number designation printed on the label of a drug or device that identifies the batch and permits the production of the batch to include manufacture and control with trace and so when we say lot number refers to any distinctive combination letters lot here and defined as version of batch. So let's not confuse ourselves. Lot number is the version of batch. While batch, this is full order, like from full order batch. That side for batch. Batch is the full order cycle of next. So now let's go to the drug establishments. We're done with the drugs, the introduction. So now what is the drug? Drug establishment. What are under drug establishment? First is the drug manufacturer, of course. Drug cannot be made without a of them. So drug manufacturer means any establishment in or establishment place. Establishments in operations involved in the production of drug interrogation, the processes, founding, finishing, pack, pack, altering, ornament, the end view of the story, on sale of the product. So, provided that for the purpose of founding and prescription in drugstores and special farms shall not be as production operation. So, yes, um, the feeding, the compounding, what I've said a while ago, the compounding production operation because it is a finished product already that need lang siya i-mix or like yeah. So cannot actually explain compounding or likely happens in the hospital and in the community pharmacy. So it is finished product where pharmacists don't want to. So we have for six drug manufacturer. We have first the ethical, the proprietary or generic manufacturer, the biological. When we say biologicals, these are the vaccines, the vials, or like veterinary products manufactured from the word vet, veterinarian, so for an animal products, or like yeah. Medicinal chemical manufacturer, also toll or control. So again, the drug manufacturers, we have six: the ethical, the manufacturers, veterinary drug product manufacturers, the biological manufacturer, medicinal chemical, ethical, proprietary or generic, veterinary, biological, medicinal chemical, and the toll or so now let's go to the drug transfer. Who are these? So if the drug manufacturers are the one who pagay, process, packing, who are the the drug trader? A established a registered owner of the drug product, course, materials and packaging components, provides production, monograph, quality control, standards and procedures, but subcontracts manufacture of such product to a licensed manufacturer. In addition, a trader will also include on and of its product. So trader. Um Okay, the drug trader, those are the people who own the drug product, materials, and packaging milligrams, but subcontracts the manufacture of such product to a licensed. Actually, I am doing this to study. Then drug distributor means any establishment supports raw materials, active ingredients, finished products, yun, distribution to a drug establishment. We also have drug porter. Also have here drug distributor slash. It's very different. Import. So when we say import, export pagawas. Exports to another country. Yun. Import, tapos mag-distribute or for example the API, yeah, there will be a drug distributor that in order. Ah, so next we have wholesaler. It's not the drug trader, they are the one they are the registered owner of those drug products, but nasa ginaward diri on na subcontracts the manufacture of such product a licensed manufacturer. So kumbaga they are the registered product but ilaha pa paid ba licensed marketing. How about wholesaler? Any that exports raw. Okay. Do not confuse with the drug distributor and drug distributor wholesaler. When we say exporter, it exports from active ingredients and product and other. But when we say wholesaler, this uh, exports pa rin raw products from the local establishment to local kumbaga din abot sa laing na wholesaler. Wholesaler from local establishment or they export raw materials, active ingredients, or finished product from local establishment or to local district. So now we have here Department of Drug and have here Department in a drug establishment. So first the research department, patent, 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 evergreen, patent, evergreen, greening, research department. When we say production department, so it involves actual manufacturing. QC department, ang si quality will be the one to check the product, like processing. And next is marketing, responsible for the sale, distribution, Engineering department for installation. Purchasing, responsible for procuring raw materials. Responsible na sila sa palit of materials. So, purchasing. Medical department perform clinical studies and health. Because in the drug establishment, well ventilated, it maintains no contamination. Again, departments in the drug establishment, research department for patent and for production. For production, involves the manufacturer actual manufacturer drug. QC or quality control, the one who makes sure that uh, the product quality, efficacy, strength. Marketing department responsible for selling, while the engineering department they are the one responsible for the installation. Purchasing they are the one who these are the this department for procure or buying the raw materials. Medical department are responsible for testing, health, yan po sa mga people nila medical and health exam. Now let's move the current good manufacturing practice, the CGM. I remember last Serbu manufacturing. Chapter 21 of the Code of Federal Regulations, Part 207. Okay. So, the current good manufacturing practice is very important. Pag na Bible, the library of current good manufacturing practice. Everyone or every pharmacist establishment follow what is in GM current good. This is in order to use a quality product. So, sa GMP, this was our first promulgated by the U.S. Food and Drug FDA in 1963 and then na-finalize siya pag 1979. Yes. Why is this established? For that minimum standards are met drug products. So the standard of the we say to produce a quality drug product must follow the standard. Others sa GMP are UK, European Economic Council, that World Health Organization, and also ASEAN or Association Southeast. Meron ba akong na-absorb marketing department? Have to fit. So now let's go to the actual or the things that were manufactured drug is that. So first, with dosage form. What is solution na siya? First is the solution. There are 10 forms. We have solution, tension, tablet, capsule, that will encounter it. So first we have uh, a solution. The general formulation is we must It must have active ingredients, solvent. Okay, for active ingredients, considered solubility and stability. It must be stable and soluble. Next is soluble and stable. Active ingredients must be stable and soluble. Solvent is considered dapat clarity, positive, palatability, palatability. And what is the best solvent? It's the water. Water. Water is the best solvent. Water. Next is the co-solvent. So, best solvent is water. Also have the co-solvent. Ang kababayan or kababayan. So, co-solvent, this is used for reaction with the to increase ion. So, what is the purpose of co-solvent? Naa naman tatay water. This is to increase the quality of the solution. For example, God, one, when we say soluble, uh, will dissolve. Example, the solute will dissolve in our a tablespoon of sugar in a cup of, basta yun na yun. So, para ma-increase ang yung solubility of the solute, para yun. For example of the co-solvent are, dapat ni an ethanol, sorbit, glycer, propylene glycol, polyethylene. Again, what are the co-solvent? Ethylene, sorbit. Again nga natin na, ano, ethanol, sorbitol, glycerin, propylene glycol, and polyethylene glycol. Okay. ESGPG. Ang pang nilalagyan natin ng etaso, etaso, etasogay, okay, yan. Etasol glyprog kasi monic. Okay. What are co-solvents? Etasol glyprog. Prog. Yan, gin- So, what are co-solvent? If the water is the best solvent, also have a also first is that we have a mnemonics for this. The etasog, 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 like etasog, like rog, rog. Kaya, etasog, ethanol, sorbitol, glycerin, propylene glycol, at saka propylethylene glycol. So again, next is go to solubilizer. Solubilizer is a surfactants or like kaya ibig sabihin ni retinol hints. Atwin, ano, pre-adult, ayun twin is, ayan, hindi na related dito. Surfactant, so solubilizer. Most of the solubilizer are surfactant. Next, we have viscosity, enhancer, and controller. So, what is the purpose of viscosity enhancer and controller? This improves durability, palatability, or some extent, durability, viscosity kumbaga yung viscosity, durability. For example, is the sugar, derivatives. Next is classification of viscosity. It is classified in enhancing a first is the ionic polymer or the sodium CMC and the non-ionic. Ionic polymer is the sodium CMC and ionic cellulose derivative. The MC. Okay, let's try to search what is an reactant at an polymer. Okay. Buffer. Some point. What is buffer? Buffer, this control pH. Controlling pH to correct. Okay. Active ingredient dapat i-consider natin na stable siya or there is a unstable. So, yung solvent, it is to maintain. Solvent, dapat, oo, dapat retain variability. Best, ano kasi, water. O solvent is solubility of the solvent. Example is the etasol, prog, ethanol, sorbitol, like that, propyl ethyl. Kalimutan. Solubilizer. So when we say solubilizer, the surfactant. I don't know what why what already, but I'm so thankful her. Naman po kami mga books. Ng at meron din practice questions after. Parang next is viscosity enhancer or controller. Ano, this is to durability, palatability. Example is the guardability and the negatives. There are two examples. Um, viscosity, sir. Viscosity, ionic, polymer, non-ionic. Yung ionic polymer, example po nito is yung MC, an ionic cellulose derivative, MC, alam, buffer to control the pH, pain or debility. And most common, pinaka pH na 4 to 7. 4 to 7. Neutral na po itong 7. Kaya at acid. Tsaka yung 8 up is alkaline. So, yung to make sure. Yeah, tama po. Tama po yun. Next is sweetening. Then, to sila solution first kahit sa paggawa ng solution, kailangan yes. So, mga wounds natin, bakit nag-activate? Pag wala pong active ingredient, wala effect. So, tapos na tayo sa active so fertilizer, positive colorant. Tapos, dito, tapos na tayo sa buffer. Yung buffer po, sa pH para ma-maintain stability. And now, let's go sweet, sweet agent. Bakit po kailangan? Kailangan po ito kasi, lalo na ayaw po flavor, at saka chloric acid. Preservatives. Bakit po kailangan ng preservative? To prevent microbial. Para hindi maiwas pag-grow natin. Kapag wala pong and instead. So again, preservative is to so there are uh uh a preservative. First, acidic. What are the phenol or carbolic acid? Other name, oldest, the oldest preservative, pinaka-old po na ginagamit now. Phenol or the acid. It's the oldest. Parabens, plastic other. We have methyl for malt, propel for methyl propel is 9 is 1. Ah, okay. Preservatives, we have the phenol or carbolic acid. Or this is the oldest. The synergistic other is parabens. Methyl is for malt, propel is the M. Yung ratio is 9 is to 1. Methyl propel. And also we have benzoic acid. Also acid. Again, applications for preservative have acidic. Phenol carbolic acid, the parabens, the acid, acid. In the parabens we have the methyl is next is we have the mercurial preservatives. We have the thimerosal or thimerosal. Have neutral the chlorbutanol, and also we have the quaternary ammonia. Excuse me. Benzalkonium chloride and cetyl cetylpyrid with cetylpyridium chloride. So yung okay. Again, we have preserved for the mercurial okay, is timer thimerosal or neutral or butanol or quaternary ammonium salts, benzalkonium chloride and cetylpyridium chloride. Okay, tel tel cetylpyridine benzyl. Ah, kain tayo. Ay, ang taas pa lang. Matatapos tayo. For the solutions, we have like this. May 10. Ayun. Tapos syempre, may 10 na ingredients na kailangan natin na meron sa ating solution. Is the active ingredients, the solvent, the co-solvents, the solubilizer, the viscosity enhancer or controller, the buffer, sweet agent, the colorants, flavoring agent, preservative. Now let's go. For the preservatives, we have this is to prevent the rot of microbes. We have the acidic, boreal, val, uh, quaternary salts. For the acidic, we phenol, the carbolic acid. This is phenol or carbolic acid. This is all these preservatives. Now we have the synergistic paraben. Yeah, has the metal and the propel. Metal is for molds and phenol. No. Phenol. Phenol. Propel. Yun pala. Met- metal and propel. Propel is for, and also we have the benzoic acid and the acid. Now let's go to preservative. The thimerosal. Well, the neutral is the chlorbutanol. Well, the quaternary salts are zirconium chloride and the methylpyridinium chloride. Na yun, ionic polymer or for the viscosity enhancer is the cellulose derivative is the MC and the yun. Let's go to the general steps in manufacturing funds. First, of course, we have to prepare the formulation, material, and equipment. Yun po yung pinakauna. Paano po tayo makakagawa kung wala tayong mga gamit? Tayo nakapag-take. Funds, active ingredients, materials, and next is compounding. Compounding yung pangalawa. What is compounding? And what is under the compounding? Under the compounding is charge and agitators and heat may be employed to increase more complete solutes in small concentration, dyes, and color, but it must be pre-dissolved prior to mixing. Ganito po. Yung solution, ah, pwede po natin. Kung under compounding, yung sabi ko kanina na extend or kaya yes, meron po dito. Charge the solute to the salt. Of course. Water. Okay, yung solute will be mixed to the solvent. Dictate the use of mixer. Importante din po yung gamit namin para po maging layer homogeneous sa solution. Heat po can be employed para po yung solubilize po tayo yung ano po yung solution po. Ensure complete solution before further process. Kinakailangan po. Next is the storage and the allow com allow complete all so this is to allow complete blending all storage and aging complete allow complete blending. Next is filtration and clarification. Filtrate ano aim for 3 to 5 micros. What do you mean by mic? Aim for 3 to 5 micron or less. Filter media. We have a filter media in the kailangan po siya ng filter media. Ano po ba filter media? First, the cellulose nitrate, polyamide, polyvinyl fluoride, and what are the filter media na lagyan po natin na phonics natin? The cellulose, uh, cell, ano, cell, all, ano, pangit po, pangit po ng ano, mnemonics. Filter media. So, filter media is Dani, Popok, ah, Dini, Palpak ni. Oh, yun, Palpak. Filter media. Cellulose nitrate, polyamide, polyvinyl and filter media, again, filter media, cellulose nitrate. Sini, pok, pol, ay, pol pala yun. Pol, polin, pol, ni. Polyethylene, polyvinyl, polyvinyl, idil, nylon. Yeah. Cellulose nitrate, polyamide, pol, poly, types of filtration. Meron po yung mga pine, polpok, 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 cellulose, polyamide, polyvinyl. Now let's go to the types of filtration. We have gravity, vacuum, pressure, filtration. One step at a time. Types of filtration. We have gravity. Gravity filtration. Vacuum is pressure is fast. Achieve. Gravity is pressure is fast. Vacuum. Vacuum. Next, pressure. Pagi classification. This one. We have parallel filter. Series. One type of filter and more. Okay, parallel is one series. More than one filter. Uh, Gravity is low. Pressure fast. Vacuum large. Types are classified with parallel one filter. Series more than. And also again we have types of filter. Ano kaya yung nasa we have flatted. We have flatted filter P. If you need the filtrate. Okay. Filtrate. Yung residue kasi yun yung nasa na-attach po talaga yung naiiwan po sa filter P. Ordinary. Ah, if you need a filter rate, you will use flatted filter residue, ordinary filter. Okay. 5 is the peeling and packaging. Ano nga yung first preparation? Preparation of the sauce for one and equipment. Next is the pounding and adjust parts with the oven. Ano lang, the saucer, pwede i-heat. So, first compress. So, preparation of pounding. Next, filter. Pinipulpok. Then yun, ay pala yung slide through. Kailangan. Yes. Polyvinyl slide at saka yun. So is meron is yun yan. Receiving or di last po na meron na dito class. Okay, okay. For mobile. Okay. Bakit kanina grabe vacuum pressure pass. Vacuum. For gravimetry, kung kanina mobile and pro tip for vacuum is for viscous. Same po. Okay. Same po. Solution. Pressure at saka vacuum. Tapos na po tayo. Paulit yung nasa sunod. Ayan lang. Okay. For suspension na. Okay. For general formulation, again. Ano ba yung kaibahan ng suspension? Solution. Suspension. So, ano po yung solution kayo na po is homogeneous. Solution po is okay, meron po tayong active gaya ng 10 pa din version aqueous should be insoluble, must be firmly the solution kailangan po siya soluble, must be firmly okay. Okay, uniformly dispersed, kumbaga scattered po. Next is dispersion medium. We have aqueous and non-aqueous. Setting agent, this air from prefixes of drug particles. For example, is the glycerin, sorbitol, at saka treating agent niya is the lyso lysos lyso lysosi natin. Yan po yung okay. Yung wet yan releases the air from crevices of drug particle, glyphosate, glyphosate, sorbitol, and the solution and solubilizer again. Mention po wala po nito setting. Solubilizer same po na solution. Spending agent wala po. Ano po ba yung meron? For me, yung meron solubilizer. For yeah. Ah, wala po. Ano po ba yung wala sa meron sa suspension na wala sa solution? Yung dispersion medium to actually yung wetting agent at saka suspending agent. Ay, meron po. Ano? Viscosity. Okay, meron po. Local calculate others. Meron po siyang acacia, agave, vegum, cellulose derivative, benton, agar, gelatin are the or hydrocolloids at acacia, agave, vegum, cellulose, hydrocolloid. We have the A for acacia at ate bis busy si ate. Okay, next na naman tayo na atin-atin lang. Ate for ate bis. So, gawa-gawa naman sa hydrocolloid. Ate acacia, tragakan, gum, at saka rice, bentonite, and choline. For others, pectin, agar, gelatin, starch. Next, the buffers with preservative, same lang po. Okay, buffer is to maintain stability and within the color preservative of the microbes. First, preservatives have acidic. We have acidic phenol or folic acid is preservative. Yung at saka salt is meron tayong acid, ah, acid, tapos salt, yung salt, tapos orbital. Kung ammonium is anong bisagon yung chloride is the paano po ba ginagawa ang suspension? Tawag. Okay. General skill problems. Problems are the partial active po yung galing active. Oo. Kailangan po kasi sa active polymorphism active polymorphism problems or and the formulation of now let's go to the formulation. We have active emulsifier, antioxidant like the emulsified antioxidant like the emulsified protein. What is the example for with formic acid? EDTA, ethylene diamine tetraacetic acid. Okay. Okay, ano po ba yung meron parang may wrong. Parang sa ano to, para sa, parang, wala na dito. Okay, so, ano po tayo, break na tayo. Okay, let's continue what we are doing. So, yung mectant, yan po natin pabalik yung ano. Okay, so ano pala yun? Kaya pala, kaya pala ay po, for the emo. Okay, for the emotion na, ano ba yung nasa, ano? Sa emulsion, meron tayo. Once sa suspension, meron po first medium, then implementing agent control. Sa emulsion po kasi meron aqueous at saka non po suspension. Meron ang emulsion, saan po ba ito yun eh? Yan po sa mga lotion. Emulsion, okay. Antioxidant, ang emulsifier at saka antioxidant yung dalaw at saka humectant. Wala na po siya. Wala siyang buffer. Ang emulsion po is buffer. Yan lang po yung component na meron sa solution. Emulsion wala. Pero meron po siya antioxidant. Next step. HRC. Ito yung example na active HA. Acid. Time in okay for continue structuring pa po. Okay. Yung emulsion, mayroong active aqueous phase and an aqueous phase. Meron po emulsifier. The word emulsion, emulsifier. Antioxidant. Ano po ba yung antioxidant? Emulsified lipid or oxidation. Antioxidant. Prevent po yung oxidation. Antioxidant. Okay. Example po is HA. Role ascorbic acid. Mga kilig. Preservative for both. Humectant po, ang sunod. Yes, tolerance, reduces of evaporation. Humectant. Ito po yung kung walang mag-evaporate. Kung wala pong humectant, vapors po. So, ano po ba yung mga humectant? Glycerin. Glycerin. Ayan. So, okay. No. ano. Okay, manufacturing, glysoprog, ano po, glycerol at saka propylene. Propylene glycol po meron dun sa, ayun, solvent at saka hydrocolloid. Yung hydrocolloid is activity, agar, ah, ito mo tachycardia. Ay, tragakan natin. Tragakan at saka gum, si, si, cellulose derivative. Ate, yung next next topic is A. Lysoprod, ate, at saka stene, pulpok, tinay. Manufacturing process for emulsion. First po is the oil phase about oil phase at about 5 to 10 degrees Celsius. Tapos, aqueous phase po is